This is a hip abduction orthosis. We're going to go over how to correctly put this on and off. This is usually used for patients who have subluxation of their hip joint, where their actual ball and socket is coming out, or they had post-op hip surgery. The physician wants this on. The nice thing with this brace is it's very adjustable, so after the orthotist fits this and gets it on correctly, it's pretty easy to put on and off. First thing first, a Velcro strap here. So we're going to put this around the patient's waist, like so. When we're doing this, we want to get this hip joint lined up on the side of their hip. And then there's Velcro here, Velcro's onto the front. Then there's this little thigh piece here, wrapped around the leg, like so. Again, another piece of Velcro feeds through a chafe, locks onto the thigh. Again, we already set this all up correctly to fit Josh's leg. We will already set the range of motion, the abduction angle. That usually comes through the physician and the orders that they want correctly for the brace. Once we get that on next, there's these two pull tabs. Where we pull this, that cinches it down around the person's waist here so that this doesn't move. Again, the idea with this brace is we don't want the patient to cross their leg because that gives a chance for the ball and socket to pop out of the hip joint. So we're trying to keep the leg abducted or out. So this is a reminder for the patient to keep their legs out. A lot of times the doctor will allow them to be sitting from 0 to 90 degrees, and it'll keep their leg around 15 degrees of abduction or out. Simple brace, easy. It's pretty bulky and big. Again, the idea is to keep their leg out. As far as taking it off, kind of reverse the process. You want to first take these off. We don't want these to hang. They might catch to your pants. So I tell patients Velcro these kind of to the side of your hip. Next, I want to take off this part around the thigh, unvelcro that, stick it back onto itself, and then release the hip. You want to make sure that you always wear a t-shirt and easy shorts or things put on underneath this. We don't want this against your bare skin. And all these angles at the joint and everything, again, will be set up by your orthotist to the correct speculations of the physician's orders. That's how you put on a hip abduction brace. That's usually used, again, for something to do with your hip.